Hello, everyone. This is Dr. Michael Kachmar, and this is Scrubbing Up with Dr. Michael Kachmar. Today's, you love that, Jeremy? Merry Christmas, everyone.
Merry Christmas, everybody.
Today's date is Friday the 17th, the year of our Lord, 2021.
That's right.
And we're here in our studio, and we're in Toms River, New Jersey. It's a beautiful day. It was like 60 degrees today. It's amazing.
Broadcasting from the penthouse suite.
Is that where we are?
Yeah.
We're in the penthouse suite today.
Yeah.
So let me just change our music over here a little bit because
That's my favorite music. I'm sorry.
You like that
I
music?
love
You like that music? You like that music?
Yeah.
Good.
Oh, thank you. Thank you.
So anyway, my name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon.
Yeah, you are.
Doctor of podiatric medicine, and I practice in New Jersey. I'm on multiple hospitals. I operate in the hospitals. I want to operate in my room, my office. I see patients in my office. We have a couple contact places to get hold of us. I'm going to give you over to Jeremy, who's my sidekick, and we also have a special guest today. She's in the green room right now. We have actually a green. Did you know we have a green room? That's where she is. We can see her over there. She can't see us. So, well, she can see us, but she's in the green room. She's waiting. And she purportedly is a expert.
Yeah, supposedly.
One of the best, one of the biggest, unbelievable expert in nutrition. She does a lot of different things, but we have products that we give our patients in our office. We have digestive enzymes, we have a calcium product, we have B complex, we have vitamin D with K2, for immune system. And we also have this other thing I take, it's curcumin extreme for arthritis. But she's going to talk about that. But I'm going to shoot you over to Jeremy. Jeremy is going to give us all our contact information. Jeremy,
that's right. We are a podcast, if you didn't know, and you can find us on platforms such as Facebook, YouTube, Google, Spotify, Audible, iTunes. Wherever you find fine podcasts,
fine wine
today, you can find Scrubbing Up with Dr. Michael Kachmar.
Go to our webpage.
It's on my first day.
All right.
You please go to our webpage where you're going to find out a lot of the things that we're going to be talking about specifically in this show. It's Jersey Shore Foot and Leg Center.com. And our email, if you want to send us an email, is Dr. Kachmar. That's DrKachmar.
Can you put it up, Jeremy, for us?
Yeah, that's right. At
so
iCloud.com. So Dr. Kachmar at iCloud.com.
Right. That's our email address. You can send us an email on that if you want to get correspond with us. And we would love to hear from you. We also right now, so we're live on Facebook and live on YouTube. You could send us a comment. You could comment right now.
And we'll answer your questions in real time.
Right.
And with our special guest, whom we'll introduce in a second, you'll have a lot of good questions for her. I'm sure.
Right. And after we're finished, after we do our segment on our special guest, we have our Corona update and our cases of the week. But let me just make a pause here, and I want to shout out and have a prayer. And this is serious for one of our very honored and she's a listener who's been listening to us for years.
Oh yeah.
Joanne Duffy. She's in the hospital right now in Florida on an intubator. She's intubated and she's got Corona. So we're praying for her.
Oh, Joanne, you are in my prayers, in my thoughts.
Yeah. She's been an avid listener to us for years.
Since the old show on the radio.
Right. So Joanne is we're praying for her. I just spoke to her daughter. Supposedly her lungs are clearing up. And she went down for an event with her family for her granddaughter, and she came down with Corona. So our prayers.
I ain't traveling.
No,
I ain't traveling just for that kind of reason.
Yeah. Well, it's tough. It's a tough one, but anyway, I just we'll get our prayers out. I didn't want to bring
God bless you.
Well, I think that if everybody prays at least one prayer, it'll help her.
Yeah.
So let's go with further ado. We're gonna talk to. We have a guest. We're gonna split the screen with her, And so when she comes on, Gigi, she will. So let's bring her on. Let's bring
Yeah.
the guest on. Further ado. So are you there, Gigi? Can we
I'm
see you?
here. How are you?
All right. So
Hey.
everybody could see you. And hello. And thank you for joining the show. So what I want you to do, Gigi, is just if you introduce yourself, tell us what your credentials are, and basically what you're going to talk about, and then we could I'm going to definitely hit you up some questions while you're going about it. But if you could, I'm looking at you right now. You're up on our screen up there.
All right.
Yeah.
I'm
So
here.
all right. So
You're a Christmas angel, Gigi. Like, you can see you.
Thank you.
Yeah.
So go ahead.
I'm
What
here to
can you tell
spread
us?
Good health among your listeners today.
Oh,
So
yeah.
I am going to just say that my profession was a registered nurse for over 20 years. Then I went into the health and wellness field, especially through nutritional supplements. I work with Nutrimetrics. It's a company that works with doctors so that they can offer their patients better health naturally instead of with drugs as the first line of defense if they want it. So we work both with medication and with supplementation. They're both really, really important. And Dr.
That's good.
Kachmar loves digestive enzymes. So I'm going to
He just had some
take
for
his
lunch.
lead and talk to you a little today about
Yeah.
digestive enzymes.
Well, let me make
He
a
had
point
huge
about that.
plate of it.
I take it personally. I've been using, I've had, as you get older, a lot of us have stomach issues. I mean, I used to be able to eat, a blue fish and then jelly, peanut butter and jelly sandwich, and then, and then
digestive enzyme
yeah,
on the side.
no, but now but the digestive enzymes, I tell you, it's amazing. It's got probiotics in it, but it's also got lactate. So if you're lactate insensitive, it has that in there. I don't know if Gigi would probably tell us better. And so it does a lot of different things for you. It ticks off a lot of bells, and plus it has all those probiotics. So you got to have a gut that's balanced. So anyway, Gigi, so let's talk about that. Go ahead. So you're the expert. So give us.
Yeah, well, I
Let's start
agree.
on that.
I mean, the funny thing is I went to a gift exchange. You know how people get to pick a gift and they open it, and if somebody else sees the gift and they want it, they get to take it away from the person. So believe it or not, my gift, and it had to be under $25, around there. So my gift was a box of digestive enzymes, and this is what is in the box. It
all
looks
right.
like-
So there is a package. It's not just a
it looks
loose
like this, and
box
it's
of
so
enzymes.
it is so awesome. You just open this straw, you put it in like a couple ounces of water while you're eating a meal. And the most amazing thing happens is that these digestive enzymes will break down the food. What's happening, like Dr. Kachmar just said, when he eats, he doesn't feel like he can eat the same things anymore. The reason why is because as we age, because of the nutrients in the soils that are not giving us what we need to break down food, because of all the adulterated food that we eat, boxed foods, right? All of these things contribute. And we need digestive enzymes to break down the proteins, the fats, the sugars. So our bodies, how many people have heard of leaky gut? Well, 20 years ago, you didn't even hear about leaky gut. It just wasn't so popular. But today it's super popular. So that just means that our foods are escaping into places they don't need to be. We want to be able to take our food and break it down immediately. And so when we take digestive enzymes while we're eating, we can immediately start breaking down all of the ingredients that are in the meals that we just had. And all of a sudden, you feel amazing. You feel like you haven't eaten the wrong food. It's super important to have over the holidays because we eat foods that we're normally not used to eating. Do you want to know what digestive enzymes can do for you? Doc, do you want me to tell them?
Yeah, go ahead.
Yeah,
Do
yeah,
that.
go ahead.
Shut yourself off there, Jeremy.
So
right there. No, blue one. Hit that.
maintain healthy cholesterol levels. It may help ease occasional stomach upset. It promotes digestion and absorption of your nutrients. So now your body doesn't have to do all the hard work when it's digesting. These digestive enzymes are going to go into the stomach and start working to break down that food to release the nutrients from the food. It provides enzymes and good bacteria, which helps in digestion and absorbing those nutrients. It supports your digestive tract and the most important thing right now, it supports a healthy immune system. It helps your skin. It supports healthy skin, and it helps maintain epithelial structure and function. So basically, when you're supporting the cells and you're helping the integrity of the cells, not only are you going to look better, you're going to feel better taking digestive enzymes. And what I love about this product, it's gluten-free, no GMOs. It's a vegan product, and it's actually isotonic capable. So it's just like the same as your pH of your blood, saliva, tears. Your body recognizes it as being part of your body instead of some supplement. It's actually assimilating into your body as though it was your own. So when you're breaking down the food, you actually feel amazing. I know people that literally cannot live without this product because it helps them so much. I know people that literally cannot. Do you want to add anything, Doc?
No. I think that, I'm just trying to see, I was just checking that you're on our thing. We're live. What I like about the digestive enzymes is where I use it in my practice is this. I give it to my patients. So if you're a patient out there listening and say your doctor puts you on antibiotics, you have the flu, you're on Z-Pak, or you have an infection somewhere. People get these things called a PICC line, and they're on antibiotics for long term, Jeremy, like maybe weeks and months. I think it's a great idea to be on this digestive enzymes.
Yeah.
It reconstitutes the probiotics. Now, what I do before I had this product, I would just give people a prescription or write it down on a piece of paper. Say, go to the drugstore and get probiotics. Right, Gigi. I'm very sure that's been your
Yeah.
So
Absolutely.
I what it is there's two things about this product that's different. First of all, you got a whole bunch of other stuff in there other than probiotics. Number one. Number two is, let's not forget, this is isotonic, and what we mean by that is this stuff is it's in powder, and you mix it with water, and it gets absorbed really quickly.
Yeah.
And instead of sitting in the stomach and like a lot of the other stuff. Now, one thing that I take a lot of supplements now. I mean, I do. I got the digestion enzymes, B complex, OPC3, but what before I did this program with the mixing with water, the pills were killing my stomach, Gigi. I couldn't stop. I took I've been taking vitamins all my life. All my life. And it got to the point maybe 10 years ago, I couldn't take them anymore. They would I used to get gastritis really bad. And this is a miracle. I could take my vitamins. So even if it's the same potency and same quality, which I think it's better, but if you go for, go to GNC, I was getting all my stuff from GNC. That stuff was killing me. It's a lot of fillers.
Yeah.
This you mix with water, it gets absorbed. So anyway, but I think so what I do with the probiotics and the digestive enzymes specifically is I put my people on this. If they're on any kind of antibiotics, let's just say you had surgery, you had your ears operated on, or you had your elbow, and the doctor puts you on some antibiotics. A lot of times when you're operating in the operating room, you get a big dose of antibiotics. You don't even know about that. A lot of people, it's routinely done. We give you like 2 grams of Ancef, which is a big dose, Gigi, and then we give you maybe 3 to 5. Yeah, and then you get 3 to 5 days of oral antibiotics. Depends on the surgery. Well, you could talk to your doctor about it, but it's not a bad idea to go on the probiotics, the digestive enzymes, and it will, reconstitute your gut. So that's what we do, right?
Yeah.
All right. So what else do you have to say? Now you can go to the full. So again, what else do you have to?
So, basically, if you ever had a meal, like think of yourself after Thanksgiving. If you ate a big meal and all of a sudden you said, I had that one last bite of dessert and it killed me, right? I'm telling you, you just take the probiotic, throw it in some water, drink it, and all of a sudden, 5 minutes later, for me, I feel like my food got digested. So I'm not feeling like I can't breathe, and it's just such an amazing feeling. But again, they have the good bacteria in there. And that good bacteria is what's helping your immune system. And again, if you are ever put on an antibiotic, it's super important to be on a probiotic. And there are the digestive enzymes have probiotics in them. And it is a vegetarian product. it just helps with breaking down that food and optimizing your digestion. So this is super, super huge for people today that have so many stomach issues. And I love the taste of it. The taste is fantastic.
So you're walking around every day feeling like $1,000,000 then, right?
Well, yeah, I mean, I really do.
Yeah, see, that's
I really
great.
do.
That's great. And see, that's where I get the best belief from, is seeing just how good you feel from
Yeah.
taking it. Now, people out there are going to want to take it too.
Well, you know
If
what?
they
There
can
are
feel as good as Gigi.
There's studies that talk about probiotics actually improving your levels of psychological distress and depression, anger, hostility. I mean, all of these
Oh
things.
no, I don't need any more of that.
Your
I do
gut
not
is
need any more of that. No,
yeah.
no.
Well, you've heard of the brain-gut connection, right?
Right.
So when you have a healthy gut, you have a healthy brain.
Yeah.
It really kind of works together. That's why you get gut reactions. Your
Yeah,
gut is
yeah,
super
yeah.
important.
So you got the digestive enzymes. What else do you want to touch upon now?
Well, I think I know that you absolutely love the B complex. So I think we can
This is a
talk
big one.
about the bees, because the bees are so important. They assist in the production of neurotransmitters, right, which are in your brain, insulin metabolism. They activate coenzyme, a fatty acid metabolism for energy, right? So important for your cells and for your nervous system. Just a cute aside, we gave this hairdresser some B vitamins, and she had always been really cranky at work. Everybody called her, something, and I won't repeat that. But
Karen?
literally, it
Is that
wasn't
it?
that bad. It was just a biatch.
Oh, a biatch. All
A
right,
biatch.
yeah.
And then, believe it or not, they said that after she was taking it for 1 month, the B complex, her personality changed. That's how much it can help your
Yeah, that
neurosystem,
actually
right?
happens too.
Nerve.
That actually happens. I've actually seen people who are like a grumpy Gloria, and
Go back to yourself.
yeah.
You're supposed to be working that. Jeremy's working the camera and he's not doing.
This
I'm
is
going to
our
take it away.
first
Listen to me.
guest.
I'm going to take it away from you if you don't.
This is my first guest.
You're like
Give
the
me a
kid.
break.
You're like you're playing. So
Yeah. No. I had a friend, and she started taking the right stuff, and her personality. I'm talking like
really,
this was somebody who was very difficult. She was the one that everybody talked about. Like when she wasn't around, like, oh my God, we have to go over this house, and you know how she is, and all of that, and she started making that change, and her personality completely altered. Like she is a different person now because of that. So it does happen. What Gigi is saying is not BS. It's a true thing. And I've seen the metamorphosis. I know it's real.
So what else, Gigi? What else? What else would the
first of
B
all,
complex get?
Nutrametrics activated B
Yeah.
complex. It delivers metabolically active forms of several vitamins and minerals. This is important because traditional forms of B6, B12, and folic acid found in most other B complexes, they must undergo chemical changes in order to be utilized by your body. So what our product has in it is it actually has the metabolically active, so it's called methylated forms of those B vitamins. And that means that your body can absorb it. A lot of us walk around, there's a huge population, including myself, that has the MTHFR gene variation, which means that we don't detox very well, and we cannot absorb the B vitamins from the foods that we eat. So we have to take them in a active form, a methylated form. So when we do that, these vitamins really work. So that's why the Nutrametrics vitamin B complex has those active forms of the B vitamins, which help promote and increase energy levels, cognition, normal red blood cell formation. It decreases stress and it improves mood, promoting healthy levels of serotonin in your body, That's
Right.
your feel
Right.
good hormone.
Right.
That's my
Let me,
favorite of all
yeah,
the
listen,
tonins.
listen, let me put me on the camera now. So I want to, let me, so here's, because, she just made a good point, and I think a lot of people may not understand what she said, not because she didn't say it correctly, but it's complicated. No, but it's true.
Yeah,
So when she's
critique.
saying that they're activated, here's the thing. I use the B complex specifically and a lot mostly for diabetic neuropathy. Now, because maybe by example you can understand. Diabetics, there's a lot of reasons for them to develop neuropathy, but there's one theory that what's happening is your nerve cells normally take folic acid and break it down. It activates it in the nerve cell, okay, and it turns it into a product that's called L-methylfolate, and that's what the cell needs to use. It's a chemical process. What happens in people with diabetes, it doesn't always work that way. So so they need that L-methylfolate. So what she's saying is that in the lab, they take the folic acid and they convert it, they activate it. They do the exact same thing the nerve cell would have done, but it's done in the laboratory. And then you drink it and you get it into your bloodstream. So it could help with the nerves to re-nourish the nerves and make the nerves healthy. Now, that could happen on a lot of other vitamins that you take that they need. So what we're doing is you're not just taking a B complex, you're taking this, a B12, B9, but there's stuff in there that's activated that is going to help regenerate that scenario. Now, and I give it for diabetic neuropathy. Now, let me just step back for a second. One thing I wanted to talk about to dovetail this is that a lot of people who are diabetics, they get diabetic neuropathy, but they're on metformin. Metformin is a great drug. Don't get me wrong. Metformin is a great drug. But if you go into the literature, and I want people out there, write this down, just go Google black box warning metformin or side effects metformin. And you'll see that metformin, which is given to diabetics to lower their sugar, could actually cause neuropathy. It can lower the B12, right? And it also produces another chemical. I don't want to get into it. It gets too complicated. But that chemical, it reduces or it increases or decreases. I forget right now. But it inhibits that chemical reaction to take folic acid into L-methylfolate. So you need not only the B12, but you also need the B9, which is the L-methylfolate. I can see that, I'm losing you.
Yeah, my eyes are glassing
see,
over.
Jeremy's getting Jeremy, look at Jeremy. Jeremy's like, but my point is that this product, this is the bottom line. This product that we're talking about, that Gigi and I are talking about, and especially the B complex is so important.
Question, okay?
Yeah, you ask her.
All right.
Ask me, but go
yeah, well, for both of you, so when I go to the doctors and I get like a vitamin B12 shot, and then you walk out feeling like $1 million, right? You feel great and all that. Am I going to get that same feeling getting it isotonically?
I'd say yes, but Gigi, you want to answer that? I mean, I've given it to people who when I first give it to people, and I'll let you finish. I could tell you personally, I've had patients and friends. They're like, oh my God, now whether or not it's placebo or real, but I used to give B12 shots. We all did back in the day. We don't do that anymore. I don't know if you're still getting B12 shots, but there's something about a B12. The thing about a B12 shot is that it's sub-Q. It gets into your bloodstream a lot quicker than if you eat it, because a lot of people don't absorb this stuff. And then it's another whole thing. But go ahead, Gigi, what were you going to say about?
No, I
give her
basically
full
say
screen.
you can take this. There's B12 in it, and it gets into the bloodstream in 5 to 10 minutes when taken properly on an
empty stomach, right?
On an empty stomach, or actually the B vitamins can actually be taken with food as well. But what I find is that we tell everybody just don't take it before going to bed. So that should say something about the energy level.
Okay.
It does promote healthy levels of your homocysteine, which is a precursor to heart issues.
Stop right there, Gigi. The homocysteine, that's the one chemical, that's the one product or one entity molecule that the metformin screws around with.
Mm-hmm.
And that is integral to the pathway to healthy nerves. And it says it. There is a black box warning with metformin. This is very important because people don't understand. There's millions of people on metformin for diabetes. And I'm not saying it's a bad drug. I'm not saying don't take it. But what metformin, what the black box require, what they're saying, metformin, their own published literature, metformin's own published literature is saying that you should take a supplement to increase that chemical you just mentioned. Okay, the hemocyanin.
Homocysteine.
Homocysteine, excuse me, homocysteine. So this product that we're giving you isotonically, basically you're drinking it. You're getting it almost the same if you took it IV. It's getting into your system. And you could reverse diabetic neuropathy to the point where, as a doctor, I could say this. She can't, she's not going to say this, but
can I just back up on that? Like, we can't make any claims that things, we're not making any claims, but like doctor said, that we can treat or heal any diseases with these products. But as a physician, Dr. Kachmar can go by the science, and he can speak from personal experience with his patients.
And I don't know. And plus, like Jeremy and I, we spent the weekend in the Holiday Inn, right, Jeremy?
Yeah, we did.
So that's why we could comment on anything.
We can comment on
but
anything.
What I do with my own patients, give me back what I do with my own patients is people will come to me with diabetic neuropathy. I diagnose it right off the bat. Let's just say it's the first time that we get the diagnosis. I put them on the B complex. Now, there are other medications I could put you on. Lyrica is one. Neurontin is another, but they are different medications. Those are medications. They're anti-seizure drugs. The one is FDA approved for diabetic neuropathy, but it doesn't cure, in my opinion, doesn't cure anything. It masks it. I mean, it deadens the nervous system. So I have taken people off of Neurontin and Lyrica and put them on B complex. I don't think there's any foul doing that because the other medications are not. They're not helping. In other words, they're going to reduce your symptoms, no doubt about it, but they're not treating the nerve damage. There's a potential for this. Again, I don't have big time studies, but metformin in their black box is recommending that you take this product or a product like this, and because it may reverse it, it may help it. And in fact, they also say metformin. If you look at their literature, it says you should monitor. If you're on metformin, you should monitor B12 levels. I mean, so anyway.
The other thing is, what's nice about it is that it's a water soluble vitamin, so you can't overdose, when you take it. And it really, really helps with your energy levels. It helps with your mood. It helps with your nervous system. Okay. So people that have a lot of nervous system issues, it actually helps with bone marrow and intestinal tract. It metabolizes proteins, fats, and carbohydrates. So these are all things that you never knew about complex. But what's really important is to realize that it is important to take your vitamin Bs in a complex because they all work synergistically off of one another. And that's just something that you should know.
You're giving me some great new Scrabble words. I'm telling you that now.
Okay.
I cannot wait to get them out there, man. Yeah. my wife's head's gonna spin.
So all right. So if people and are out there who listen to us and are diabetic and you got neuropathy, you should be giving the office a call, 732-269-1133. 269-1133. Contest, give us an email, give us a call on the webpage. But we get in to see us because I can tell you that's one product that we have patients who I can't keep. I mean, I don't know. We get people coming in. We sell it. We get in our office, but we can tell them go to the webpage and they can buy it there. Yeah. But they love it. It really works, and I think it's a lot safer than Neurontin and gabapentin. You get blurred vision with that stuff. There, you got to worry about depression with that stuff, and I think it's the opposite with this. And we do it. We double dose on it. I give them 2 capfuls, so that's just my preference. I'd rather have them come and see us before they start taking it on their own for diabetic neuropathy. Yeah, it should be doctor modified. You go to your primary doctor, your endocrinologist, whoever you want to go to, and ask them. Say, listen, I listen to Kachmar on the radio and on YouTube, and he's telling me I should take this. So, I I think it's worth a discussion with for whoever your doctor is, and maybe move to that. What were we gonna say,
Dr.
Gigi?
Kachmar, I just love the fact that you are, a doctor that actually goes the natural route when you can, knowing that it works. And other people that are specifically at risk for deficiencies in vitamin Bs are vegetarians. And
Yes.
every vegetarian knows that. And I want to tell you something else. Being a nurse for so long, people would come in, those alcoholics would come in. The first thing we'd have to do is shoot them up with some vitamins and B complexes because they were going to have the DTs. Their nervous system was shot because the alcohol just completely destroys B vitamins. A lot of medications will destroy B vitamins. Those who take prescription or over-the-counter medication, drugs, they have to think about taking B vitamins in their life because they're taking other things that are destroying their Bs.
Yeah.
Maybe that's why they're depressed or in a bad mood or
Right.
their nervous system is shot.
Or it could be extreme amounts of alcohol.
Well, it could be the Z's too. The Z's, I think the Z's and the X's go after the B's.
Right.
There's a little conflict going on there. You know what I mean? So
if you're drinking liquor and you switch to wife beater shirts, that's your first red flag.
So let me make a point about what you just said about vegetarians. So it's funny that you mentioned that because Thursday I had a patient come in, calf pain. He's an old patient of mine. So he might be in his 40s. So he's got calf pain, and which is interesting. And so I'm working him up, and he's got good circulation, no injury, and he's got some foot deformities, flat foot, little bunions. So he thought maybe that's it. But as I'm going with the history, Gigi, he is a vegetarian now. And so I said, well, are you a strict vegetarian? He goes, fish once in a while. But or maybe a little chicken, but pretty solid. And so then I asked the guy, and this is so funny. This is very typical of patients because I could easily make the diagnosis. I said, did it correspond? Did your calf pain start? Maybe a little bit after you became a vegetarian. He's like, yeah, come to think of it, it did.
Yeah.
But I'm like, why don't you put two and two together? But they don't know. But here's the thing. I'm doing a slew of blood work on him. I don't know if we're getting some other x-rays. I forget, but we're going to do blood work. I'll do Lyme's, rheumatoid, but I'm going to look at his B12, his folic acid, his vitamin D. But I suspect with him, and then, with his feet, they're a little bit flat. I don't think it's anything more than he's getting a vitamin deficiency. No. Mm-hmm. We see this also with people who have had gastric bypass.
Yes.
They're notorious. But she also makes a good point. Drugs. Now, and I'm not saying this is the case, but people with smoking marijuana, that stuff's not. There's pot. And alcohol. We know alcohol for sure, right. And then everything else that everybody's doing out there. So
even caffeine.
Caffeine
will. I mean, we're drinking, I drink caffeine, but the cool thing is if I'm drinking alcohol or I'm drinking caffeine, I'm going to take a supplement that will counteract the bad effects of what I'm doing. So one of the things is I have to super be important. And anybody with heart disease, anybody has to be on B complex, especially the activated forms. Caffeine, people with poor diets, gastric bypass, those are all so important to be on these, especially the isotonic supplement. I call them the Rolls Royce of delivery system. When you have a gastric bypass, you don't have enough room to be swallowing pills in your stomach or to get through to the stomach.
Sure.
These will go into the stomach and they'll get absorbed, bypassing the stomach, going directly into the small intestine where the villi are, like straws.
The villains are.
Right
the villains.
That's why these
isotonic
nutritional supplements are so important to be taking.
Well, that's very important what you're saying there, because again, we don't talk about this enough, but what's unique about this product is that it's isotonic. And I don't want to beat a dead horse, but what that means is it's the same pH as your stomach, but more importantly, you're drinking it. It's a liquid form. The stomach doesn't have to break it down. Like she said, it's shooting in there. It's already, it's got to break it down a little, but it's so quick. And I think they've done studies, 10 minutes into the bloodstream, you take it on an empty stomach. And so, and I think that it gets delivered better. So let me just recap with the B complex.
Well, before you go any
Okay.
further, let me just tell
Okay.
you, Gigi, my calves look amazing. Seriously, I could have been a rockette.
Oh, your calves?
Oh yeah, but you make different choices in life, you know.
Yeah, calves. Jeremy's in rare
Don't worry,
form today.
Jeremy. I'm getting you on all these supplements. 'cause
Yeah, good luck with that.
All right, good luck with
Jeremy,
that.
we tried already with Jeremy. So listen,
2022 is your year.
so listen, let's go to the next thing. So we got what's your next thing you want to talk about, Gigi? So
Well, we can talk about vitamin D or calcium. Which one you want?
no, I want to go with the vitamin D with K2. So I got a question about that.
Sure.
So everybody always asks me, but I want you to answer it. Vitamin D, what's the importance of vitamin D? We all hear about, you get vitamin D from the sun. So I think in the northern hemisphere where you got less sun, because today it's 4:30 is going to be sunset.
Yeah.
So I think in the winter we could be vitamin D deficient, and there's some arguments what differences it make. But the other big thing about vitamin D is with this coronavirus. Now I'm not making any allegations or saying, vitamin D is going to stop it, but there is the idea.
I mean, doctors are recommending vitamins. If somebody says they get, they have, the virus, they're telling them, and this is with a cold too. People would always take zinc, right? You take zinc.
Right. But I think the point I'm going to make is that I think it's well known though that, and I don't know what you could mention this or tell me about how we notice is that it supports the immune system.
Right.
So what does that mean? So let's go back to our list. So what does it mean when they say it supports vitamin D supports the immune system? Because we know a good immune system may be able to fight off corona, but beyond, but how does vitamin D and what's the reason to have K2 with it? Because that's how we sell it. That's how it's given. So give us a little bit.
K2 leads. If you have an insufficient amount of vitamin K2, it leads to decreased bone mineral density.
Okay, what's vitamin K? Just explain to our audience what that is.
So, it's a key factor in osteoporosis, and it comes from foods. But now you think about vitamin K, and you're like, well, I'm on Coumadin, I'm not allowed to have vitamin K. Well, vitamin K is a nutrient that K1 causes clotting, okay? K2, the literature does not support the fact that that's the K that supports clotting. What it does, it's a nutrient in your body that actually makes vitamin D3 work. And that's the proper form to be taking is vitamin D3. It is a key factor in like osteoporosis.
Okay, so stop. So stop. Let's stop because you made a couple of points there. So let me ask you. First of all, let's just say I never heard of vitamin D. I know vitamin A, vitamin B, but vitamin K.
Yeah, you thought they skipped the
so that's number one. Number two is, are you saying that if you just take vitamin D, you may not get as much benefit unless you piggyback it with vitamin K? Too?
Yes, I'm saying that 100%.
Okay, so what now? Let's just take it nice and easy, slow, but tell me you understand. Like we're Jeremy right here. Look at Jeremy. He has no idea what's going on. So like Jeremy is like this is Jeremy. Yeah, Jeremy.
Crickets, right?
I love my little thing. So go through that because it's so important, Gigi, what you're talking about. Because I got patients ask me this all the time, and I don't have the time. I got, I'm an hour behind and they want to know, what's K2. And I start talking to them and I'm like, and the girls in my office can't. So I could refer them to this, this lecture we're doing right now. So give me on a real basic level, the product that we're talking about is a vitamin D with K2. It's on my webpage. So give me.
So K2 promotes the synthesis of proteins, which is involved with calcium utilization. Now you're talking vitamin D is superb for your bones, right?
Right.
For bone retention and arterial health, your heart. Vitamin D supports healthy regulation of osteoclastin, which is like bone and mineral binding capacity of this protein.
Bone healing. I give it for bone. I push it for people who I operate on them. I cut their bone or they had a fracture. I try to get them on that and with calcium. I get them on vitamin D with K2 and calcium. especially if they're postmenopausal older people, who I think may have, or if they smoke, which reduces bone healing, and if they are on anti-inflammatories. I try to take them off anti-inflammatories, but if you have somebody who's on, a chronic anti-inflammatory for rheumatoid or degenerative joint disease, it's difficult. And those things definitely in the literature inhibit bone healing. So just throw it out.
I got to tell both of you, this is really tough making jokes about this stuff.
I know, it's like,
I mean, honest to God, like, why am I here?
So go ahead. So go ahead.
So just remember that vitamin K2 helps deliver the calcium to the bones and helps maintain your arterial wall health. So, I mean, vitamin D assists all of these processes. So any formulation that Dr. Kachmar has in his office are created in a synergistic blend that allows the nutrients to work together to give you the biggest bang for your buck. I'm telling you. Plus, on top of it, the Rolls Royce of delivery systems, getting it into that bloodstream right away.
Right.
That's a great term there. Yeah.
So Gigi, so we're talking about,
you should go into marketing.
We always want it with the calcium. We always want to do the D with the K2.
Right.
And that's how
the vitamin D piece. So the K2 allows the vitamin D to work optimally.
Right. And that's the only D that I have. We have the vitamin D that we have is K2 is in it already.
And let me tell you something. Most people take way too little vitamin D. Vitamin D is probably one of the most important vitamins, even though it is a hormone, right? You can read up on that a little bit more, but
especially now with COVID, D and zinc are very important to help fight off the disease.
She made a good point, and go just a little bit expand on that, Gigi. It's a hormone.
I want to just tell you that the upper limit for vitamin D, according to the Vitamin D Council, which is a bunch of doctors that have really done their research, it's a good dose is 10,000 international units. Most people are taking like 800. I've seen vitamins have 300 and 400 IUs in it, but our product has 5,000 international units. You need a lot more vitamin D than you realize in order to really have things work in your favor. I'm going to actually mention some studies that I was reading about. And one of them is that in the clinical journal, the American Journal of Nephrology, vitamin D deficient women have a 253% increased risk of colon cancer. So it's not only that we're helping.
What was that one, Gigi? What was that? Where was that article? What was that?
It is in the clinical journal of it's in the American Journal of Nephrology.
Why nephrology
because they did
colon cancer? What?
They did this study. And that was they did studies on other things as well that had to do with, the kidneys, but they also did a study on D deficiency and found when they were doing other studies that women who had deficiency in vitamin D, and I'll tell you, when I've done my own reading about vitamin D, there's over I can't remember how many, but it's major, the amount of cancers that have low vitamin D. So just keep your vitamin D levels. Men with low vitamin D levels suffer 2.5 times more heart attacks than they would if their levels were higher. And that was archived in the internal medicine.
So let me ask you this, Gigi, with the vitamin D, because I was always told and I read and we trained that your body takes the sun and your skin you make vitamin D or you produce it, but I don't know how much. And if you live in, say, Florida, or you're out in the beach every day, or you live in a tropics, can you still be vitamin D deficient? I think.
Yeah, absolutely. Because we're putting suntan lotion on all the time when we're going out. Women's makeup has sun protection in it, sunscreen in it, and so the minute we put And our children are deficient because we slather them up and we put them in. We need to get about 20 minutes in the sun to really be able to get that vitamin D. And if we're living in colder climates, we're not getting it. If you have dark skin, you're even at a higher risk of not being able to absorb that vitamin D. Women with the lowest levels have been found to be at a 222% higher risk for developing breast cancer. And the bottom line is most studies show that higher levels of vitamin D can actually reduce breast cancer incidence about 30 to 50%. So it's so critical. You know, we think of it for bone and we think about it for the immune system, but we do require not only, you know, higher, not just like 200 or 300. We need a nice, good dose. And this company is giving us the dose that is actually beneficial for our health, which is 5,000 international units. And it's going to help support your bone health. It's going to lower the risk of falls and normalize your muscle function. It supports normal levels of inflammation, which is important in combating infection and cancer. It supports the body's ability to bring an infant to term, you know, for a pregnant mom. It supports heart health, your arteries, your muscles.
Yeah, so there's a lot. Yeah.
I mean, vitamin D is like one of the heroes in our immune system.
Yeah.
It is one of the heroes.
Well, I think that you know, the things that we talked about today. I think we need to recap. And all this stuff is great. I'm already. It's we almost 50 minutes we talked about. We could go on for hours and hours.
Yeah.
So here's what, Gigi, I want to say this. I want to get you back with your slideshow. You know, I really think that the stuff that we're talking about now is so important. And we got the B complex, which for me, I'm a big fan of that for diabetics. And if anybody wants to come to the office with diabetic neuropathy, we could try to transition you on that medication and get you off the Lyrica and the Neurontin, which I think are dangerous medicines. And that's number one. Number two is, if you are post-op or post-fracture, had an ankle fracture, arm fracture, it's not a bad idea, especially if you're smoking or you're on anti-inflammatories, which could all inhibit bone healing, to be on this vitamin D with K2 and calcium. Again, you could talk to your doctor. You could ask them. If they okay it, you could go to our webpage. It's JerseyShoreFootAndLegCenter.com.
That's right.
You go right on there. You go down. There's a banner. It says Nutrimetrics. Bang, you hit it, and you could purchase it. And I think the prices there are very reasonable and competitive.
And considering they work so well, don't waste your time going to the big vitamin stores, getting one of those oversized bottles, and then popping them in, because you're wasting your time with them.
Well, they sit
you really
in your
are.
The other thing is what she mentioned is say with vitamin D, but even vitamin B12. What's the downside? Okay, say we don't know for sure, and it's it's because I've read articles where you just pee this stuff out, and if you just eat a good balanced diet, you'll be fine. Right. But let's just say, okay, I'm a little bit on the borderline. Should I? Shouldn't I? So you're spending money, but most people that I see in my office buy this stuff anyway. And they're taking it. And we're saying, listen, we got a better product for you. If you are taking it already, it's isotonic. But the other thing is, it's take the change. I mean, to me, there's really no heavy duty downside to taking this stuff as long as you follow the manufacturer's recommendation. And the potential on the other side of benefit is so high. Yeah. If a third of the things that we're saying happen, you're way better off, right, Gigi?
Well,
I mean,
I just want to leave my final comment that when you go to Dr. Kachmar's website, you will actually be able to read all about everything that vitamin D does. Yes. And it will show that it supports immune modulation. And it's thought that the supplement promotes immune health by regulating the T cell function. And this is super important for, our immune system. And all of the medical literature is listed on every ingredient, and every ingredient is listed there, and all of the studies and the science is listed below that. So, I mean, if you're that kind of a person that likes to geek out and all this stuff, you're going to be able to geek out on it on Dr. Kachmar's website to find out like just how incredible these supplements really are.
Yeah.
So,
Well, Gigi, listen, I can see we could go for hours and hours
Yeah,
and
we
hours.
could.
I want to get you back. I want to invite you back. I'm very, very happy that you're here. So I've been working with her colleague, Lisa, and basically when I get people in the office who, we just diagnose them as a diabetic and they're pre-diabetics. The big ones that we take care of are pre-diabetics. I get them in my office. They got maybe a wound that was not healing well. They got some neuropathy, and we do the blood work, and A1C is, maybe 6.3 or, 6.2. I get them right over to these gals, and we start working on their diet, because at that point, we're not going to give them, the primary doctors or endocrinologists are not going to really give them anything. They're not going to put them on metformin or any kind of medication. It's strictly at that point kind of a diet thing. And who better than the experts? And that's what we have Gigi and we have Lisa for. So we send them right over, and they work with them, and they put them on these, get them on these supplements, get them on a diet, or get them on not even a diet per se, but foods to avoid, and try to help them out. So Lisa, listen, thank you for coming on.
Gigi.
Gigi, I'm sorry. I'm thinking Lisa now. I'm sorry, Gigi. And I was thinking Lisa. And I want to invite you again back with the slideshow. We're going to have to work on our technical stuff so we could do the slideshow. But I could tell you right now, it's so informative. And I bet you some patients out there right now learned a lot. So you got the B complex, especially if you're diabetic neuropathy, but it helps you on so many other levels. You don't need to be have a diabetic neuropathy to take that. You got the vitamin D with K2 and calcium, or at least the vitamin K, vitamin D with K2. You have I really love the digestive enzymes. I tell you what, if you're an older geezer like me and you got stomach problems, and you know who you're out there, it's amazing. I could still, now I could get away with a lot of stuff now. Not that I could go back to my old ways. I have to be careful, but I could tell you the days of, Pepto-Bismol every day, it's done. No, really. And I was taking for a while what do you call it? What's Pepsid? No, the Pepsid. Antacid.
Pepto-Bismol.
No. A Pepsid. It's a for heartburn. It's a
Tums like that.
No. It's a I
running
can't
out of stuff here, Mike.
Yeah, no, but it's for people.
I bottomed out.
No, it's for people who have heartburn, right, Gigi? So
Yeah.
but Pepsid and there's all different kind of medication.
Well, we can talk about aloe and the digestive enzymes, how that can really, really support that burning in your throat.
Yeah.
Right. But I don't get that anymore with the digestive enzymes. That's my point.
Right.
I don't take the Pepsid anymore, because I think that I don't have the need for it anymore. And a lot of people take that stuff every day. They get heartburn, they get the regurgitation, they get the gastritis. The gastritis is another thing. And, you've mentioned that. I stay away from coffee. I still have tea, but if I hit coffee, I get gastritis
I was
bad.
weaned on tea. Yeah.
Right. I get it right there. But there's I meant to say it's antacids. So that's Pepsid. So I don't take the antacids anymore. That used to be where I was told, as you get older, you produce more acid in your stomach, especially if you're stressed out, the fight and flight thing. Yeah. Caffeine also doesn't help with that. You produce more acid. So what happens is you're drinking like 5 cups of coffee a day. You're stressed out. You start getting a lot of buildup in your stomach of acid. It hurts. So you start taking Pepsid, that whacks your bones. So it's this whole thing where you're going down what we say, the wrong road, Jeremy, the wrong road.
The wrong road.
So personally, I like, for me, I got on the digestive enzymes. I gave it a few months, and eventually it really regulated. I tried it. Now I have a little alcohol. I try to keep it under, I don't take the coffee.
Remember that old commercial, plop, plop, fizz, fizz, oh, what a
Yeah. That was
Alka-Seltzer. That was
Alka-Seltzer. So anyway, Gigi, listen, thank you for being here. We're going to sign you off. We're going to finish our show. We're going to talk. You're more than welcome to continue to listen to us. We're going to talk a little bit about Corona.
The beer?
What's that?
The
Cor-
beer?
Oh yeah.
No. We got a little.
Wow.
We just want to get. We look at.
Gigi's bringing back the old jokes.
Right. We're not experts, but we're just doctor. I'm just a doctor looking at the literature and trying to interpret it. And we have a following. We have a lot of people who want to hear us. So anyway, Gigi, thank you
All
very
right,
much.
take
We'll
care,
see you.
guys.
All right.
Take care, Gigi.
All right. Very good. Thank you.
All right.
Thank you. All right, Jeremy, how we're doing here?
Yeah, we're doing great.
All right.
Listen. I say we wrap this up as one show. We have another.
No, I want to do a
No?
little bit about our. Just give me another. Yeah, no, I want
Because I
to.
could do another hour.
No. Well, we just keep going. We
Yeah,
just
we'll
keep going.
Keep going then.
Just keep going. So what we could, I want to pull things out, but what we want to talk about now is Jeremy and I, we're going to shift gears right now. We're going to talk about this Corona
Yeah.
and a little bit of politics. And we're trying, I got a primary doctor who wants to come on. We got a couple actually, but there's one who we reached out to, and he writes a blog every I don't know week, and he treats a lot of patients, and I like to get him on here. But
I got something I want to tell you here. I didn't tell you this one.
No,
I
go ahead,
didn't
tell
tell you this one. Now, like I watch Fox News on their app,
Right.
Okay, and so when you're doing that, you're getting a different set of commercials being played. Now they have no control over what commercials are being played on their thing. It's just automatic, and all that.
Right.
But one that's been repeating constantly, it's the most disgusting commercial I've ever seen in my life. It's from New Jersey, NewJerseyHealth.gov or something like that, or .org or whatever, NJ.health or NJ Health, whatever.
Right.
And it opens up with like this little boy, right? And he's writing a letter to Santa, okay? And he's like, he's writing, he's like, "Dear Santa, I don't want games this Christmas and I don't want toys. Instead, could you please give me the Corona vaccine?"
Yeah, I'm listening. That's terrible. Yeah, I
and-
know. That's like so wrong in so many different ways.
So disgusting. And because who is that? Who are they advertising that to? The kids that are sitting at their parents' knee while they're watching Fox News or even on YouTube. I'm sure it is. Wherever you go, they're advertising to little kids now to get the vaccine.
Well, let's just talk about this because so this is a great thing. So Gupta,
what do you think about that?
Well, I'm going to tell you. But you got to answer.
Yeah.
Dr. Gupta was on Sesame Street. Dr. Gupta.
Oh boy.
And they were basically saying,
I didn't know this.
that basically, I don't know what kind of word to use, but persuading the child and children that they need to get the vaccine. Let's just stop here and let's just again. Do I know? Here's what I'm going to tell you. I just watched a 3-hour Joe Rogan show with Dr. McCullough.
Mm-hmm.
Now, Dr. McCullough, you guys could go look it up. I don't know if you could pull up the email. Just get the. It's like I put the email. Well, you know what? Don't worry about it. It's on. The people could out there. You could go to Joe Rogan and archive Dr. McCullough. Dr. McCullough was just on there, and the other one that we talked about last week was Jay Badajachi. I don't know if I'm pronouncing his name. He's another one. And these people were in front of Senate. These are highly trained.
This Dr. McCullough, for those of you listening,
he's probably written more papers about Corona than anybody else.
He was recently on with Laura Ingraham on Fox News. So
right.
Check that
out. So we're parroting what they're saying.
Right.
This is not our original stuff, but this is what Dr. McCullough said last week. A couple of things. He said, number one, which is very important.
Mm-hmm.
This drug, this vaccine is not FDA approved. It's still experimental. It's under emergency. This is what he's saying, not me. This is what he's saying on Joe Rogan, that this is still not, it doesn't have the, you ever see it on TV when you like there's a show for psoriasis, a pill or a drug for psoriasis. It says, oh, psoriasis. And then you see the people jumping in the pool and everybody's happy and they're grilling. But then after that, they go, oh, listen, it could cause tuberculosis. It could, right. Well, that's the FDA. When you have a drug that's approved, there's this balance. What's happening here is we don't have that yet. Yeah. And it's not really even a vaccine. It's a messenger RNA product. And again, this, I think it's terminology but what it's not, he's saying now, it's not approved. It's still a
Right.
experimental. And it's actually, if you think about it, when you go in there to get it, if you're not mandated, then it's up to you if you want to be a trial. Because basically, if it's still under experimental emergency, what do you call it? Usage, then basically you're in a trial, right? You follow me what I'm saying, Jeremy? You're on a trial. The other thing he was saying is that so to push it on children, and without giving the side effects. Now, I don't know how many people, died from the corona vaccine. How many? One thing I do see that's coming out, more and more studies. Again, I'm just parroting this myocarditis, which is inflammation of the heart. Okay, this is happening now. He's saying he's seen about, I don't know, thousands of cases in the United States. I just would reference people. Don't take what I'm saying, but go watch the Joe Rogan. It's a long show with Dr. McCullough, or look at his stuff, because we're right now, I think we're biased on, happy land. And I understand with the government, if it's like, we're going to save 1 million people, but we're going to kill 10,000. Yeah. I mean, maybe that's a good strategy, but I don't think they're being honest with the American public. So anyway, the other thing that was interesting with this doctor talked about, we talked about, is this. He's saying, this is Dr. McCullough. And again, I don't know if this is true or not, but you get corona once and it's it. You're done.
Yeah.
Which again, think what I'm saying now. So in other words, if you truly had it, you got immune system, you got T cells, you're not going to get it again. Now, I don't know if that's true or not, but what he's saying is this. What he's saying is you could do a test now, and you could actually, LabCorp does it, and I guess Quest does it. You get T cell detection. You get your T cells looked at. You may not have antibodies. Now, I probably have antibodies because I've got the booster. I had two vaccines and a booster. But I would show antibodies, but I don't think I would show T cell immunity. I don't know. But if you definitely had corona, or you think you had corona, and you didn't get the vaccine yet, you should get that T cell test. That's what I'm thinking, and see if it's positive. So that means you've had corona for sure. And do you need to have a vaccine then? He's saying, Dr. McCullough's saying, once you get it, you don't need it anymore. You don't need a mask. You don't need, it's one and done. Now, I notice there's viruses that act like that. You get the vaccine for polio once, you're done. You get yellow fever, you contract yellow fever, you don't get it ever again.
Yeah.
Okay. But there are other viruses that you get over and over again, like the flu virus, because there's different receptors, N and H. So again, I'm not an epidemiologist. I'm just a foot and ankle surgeon, but I'm listening to these people out there. I'm seeing more and more people who are saying, whoa. And these people are like eminent, Harvard, Yale. They're saying, no. So I just want to throw people out there. We don't have the full picture yet, but I can tell you right now, if the children is, I've been always saying that, I say, listen, if you're an old geezer, get the damn vaccine. And again,
no, but see, and this is to my point.
So
okay,
and it's talk about the elective surgeries, because
I will. I'm going to get to that. I'm going to get to that, but I need to say this first. Advertising to children. See, when to Dr. Kachmar's point, he was talking about all the irrelevancies that we're going through when you have if you've had COVID, you don't need anything else. It's simple as that. But in the middle of all of this, okay,
to have a commercial where you're telling a child, that's
yeah,
to me, that's,
you've got
that's
a
wrong.
child and you're
wrong.
making them advertise to other children. And this is from our state. This was njhealth.org or .gov or whatever the hell it was. It's reprehensible is what it is. And again, it is the government's consistent means of trying to control or take control away from parents, because once they got they brainwashed your kid, and your kid is now going against their parents on what they want. That's a tough argument for a family to have. I had that, or I've had that discussion with my boy, and Maggie and I. It's a tough one. So when you have commercials that are actually making it so innocent and making it so simple for children, and but with a healthy dollop of fear behind it. You know, it is a reprehensible thing, and I think there's got to be some legal ramifications about an advertisement like that.
Well, here's the thing, Jeremy. You know, we talked about risk versus benefit. We had a couple shows back where I looked at the CDC and we talked about their, reports. Here's what I'm saying is that, we're this vaccine, there are more and more people coming out questioning how safe it is. And it's all about risk versus benefit and who you are. So that's number one. So I'm telling people, listen, look at this guy, McCullough, look at other people, and really understand what you're getting into here. I'm not saying don't get the vaccine, but also we talked about is what he talked about, Dr. McCullough, is that there's really not a lot of care before the hospitalization. So what they tell people right now, even today, you get the corona, you get tested positive, you're 55 years old, tell you go home, drink water, take some Tylenol, and if you make it, fine. If it gets to the point where you can't breathe anymore, then you come to the hospital and we're going to treat you.
Right.
And then that's probably too late. I mean, that's like saying, think about this. You get diagnosed, you got a skin cancer. I don't know. You got some cancer somewhere and small. And they say, you know what? Just go home.
Yeah.
Let it go. And then, but
I'll take a brisk jog.
Wait, see if it spreads. See if it spreads.
Yeah.
It might not. So maybe that's not the best analogy, but here's the thing. You got mono.
No, but it's a good analogy, and it's a very real analogy because you get patients all the time who have something growing on them and stuff.
Well, we're gonna jump right on it,
and they keep them to themselves.
But
before they even come to you.
But here's the thing: you got a 7-year-old guy who gets corona.
Yeah. And
maybe he's even been vaccinated.
Right.
All right. They send him home. He sits there, and suffers. Nobody can see him. He's isolated. Yeah. Maybe 14 days later, he can't even freaking breathe. And then, everybody's got to go there. The sons, the daughters, everybody gets exposed to corona. They get him to the hospital. They put him in ICU and he dies there. Nobody's next to him.
Right.
How about we push monoclonal antibodies? Say, right now, it's a high, you got to be 65, maybe comorbidities. They can make 1 million. They could make tons of that. Why don't we give these people monoclonal antibodies? We've had it for years. It works. The CDC says it works. 70, 80% reduction of hospitalization. We should be ivermectin. Again, I don't even care about that. But there's studies out there. Why aren't we giving?
There are other things. There's other choices.
But here's what we're going to do. We're going to vaccine. Now, here's the other thing.
All of our eggs in one basket.
Right now, there's tons of patients I know personally who've been vaccinated who are getting corona.
Yeah.
So and they're passing it to other people. Yeah. So don't tell me this bullshit. Oh, I get vaccinated. Oh, you get vaccinated. You got to get it because you're going to help other people. Well, the freaking people who got vaccinated are giving it to other people.
Right.
So when did we start? The American public is smart in this. That's why I said no mandates. People will know if they want to get vaccinated. Listen, remember all the vaccination places where they had the cones and the big. They're all gone. Why? Because people are like, you know what?
That's it. No, I'm not doing
it. Now my friend's daughter, she's 20-something years old. Yeah. She's coming home for college. She had corona.
Right.
She's 20-something years old. She's not married. She's in college, but she might want to have children one day. She had 2 shots and corona. She had corona, lost the taste and everything. Pretty sure it was. And then they still made her get the 2 shots. Now she's 20 years old. She's coming home. She is not going to be able to go back to college after January, after winter break, without a booster.
No.
Mandated. Now, so let me make one more point. I know you want to say something, but here's the thing. I'm on my soapbox. Let me get going.
You got a big one.
So listen. So people say, listen, and this is what they said about Dr. McCullough. One guy said, Dr. McCullough, if you tell people don't get vaccinated, now I'm not saying don't get vaccinated. I'm not saying that at all. I'm not saying do or don't. I don't think it should be mandated. But Dr. McCullough makes this point. He's saying, well, if he's saying in his point, it's not necessary, let's just say. And then if somebody dies, they're going to say it's on him. But what about if you get the vaccine and you get some long-term sequelae? We don't know. Myocarditis. Maybe you die from it. I don't know how many people. Then it's on them. Then it's on you. a lot of people could dodge this coronavirus, especially the young ones, or if they had it already. See, my whole thing basis is on this. This is where I'm asking the question. I'm putting it out to the audience, and I'm not, because people listen to this and they're going to be critical of me. And they say, oh, you're just a foot and ankle doctor. I'm just a doctor. I'm just a person asking this. First of all, I want the government to tell me, is it true or not that you can't get this again? Is if you truly have it, how much immunity, are you bulletproof? Or can you keep getting it, and does the variance matter?
Now, while you're asking that question, are you also holding your breath? Because don't.
No, I know. No, I'm asking that, and I'm asking, can you get it again? And then, and then to piggyback that, if you did have it, so then if you did have it, why do you need the vaccine if you can't get it again? Now, so they're saying, well, you could get it again. But you got guys like McCullough. So here's the thing.
That's the $10,000 question, though, Mike.
He's not an idiot. This guy has credentials out the butt.
Yeah.
So we're and
that's enough of his butt.
No, but so that's why I'm getting so passionate about this. So I'm not saying don't get. Listen, I got the booster. My friend's daughter is probably going to get the booster, but it's still, it's not 100% FDA approved. I mean, that's what he's saying. This is Dr. McCullough and Peter Navarro. They're saying this is an experimental. It's still not FDA approved. Maybe it's semantics. I don't know, but I'm just a dummy. Maybe we're too stupid to understand.
I'm up for semantics.
But right, Jeremy. So where are we going with this? And we're still isolating people. We're getting another lockdown. Now, you said about elective procedures.
Oh yeah, let me talk about this now. All right. So Dr. Mike and I we were talking in the car. We were listening to the Joe Rogan podcast, and they mentioned, well, here it's all about it brings back fear with the variants that are out there.
Right.
So initially what happened was we started getting a whiff of the Omicron variant. Right. So what was the first thing that was it de Blasio is his name, or Blasio?
No, there's a woman now. There's a woman up there. He's gone.
Well, this is what he did. This is what he did. Okay. His first thing was shut down elective procedures in New York.
That was the first round of corona. They did that. They did that here. They did that in the state too.
They didn't even have a case yet in our country, and he shut that down.
Oh, you're talking about just recently?
When Omicron was first being talked about, this is what he did in New York. Okay, he shut down elective procedures. Okay. Out of the fear of what Omicron might bring. Now, since then, we've discovered that it's nothing. It's very harmless.
I wouldn't say it's harmless. No.
Well, they are calling it mild. So let's use that word.
Listen, what we just learned. What he said is, McCullough, is that the transmissible rate is Delta's 10. This is 4. The wild one was 2, but so may not be as transmissible. And we don't know yet. But
my question was to you in the car. Well, if elective procedures are shut down in New York, isn't getting a vaccine shot an elective procedure? Isn't that so?
Get into semantics.
And now with Omicron becoming as mild as it is, and it's not the threat that the Blasio, whatever his name is, thought it was. When do they retract that?
They won't retract.
See, that's what I'm saying. It's like one thing triggers them to do something, and then when you find out it's nothing, well, the mandate's still there. There's no control over these mandates.
Listen. What I'm saying is this. We said this last show and the show before that, and the one after that or before that, is
if this was like an emergency. If these were emergency powers that we're giving to our government, okay, under said title, emergency powers.
Well, that's what they're doing. That's what they do. They do. We're still under.
They're going beyond. They're going beyond what their natural emergency powers would be when they're dictating what laws are and changing laws with these mandates.
Well,
who is governing when they take back those emergency powers? Well, that's what we need.
You made 2 points there. When you have emergency powers. You got the national emergency, and you have what do you call it? You have You have natural. So what happens is you have a state of emergency. It's like a big snowstorm is coming,
Right.
and the governor of the states and the president of the United States, for that matter, has increased powers. I think in New Jersey we're still in a state of medical emergency, so it gives the governor a lot of power, the executive branch, and so the executive branch could do things without maybe collaborating with the judicial branch or the legislative branch.
But the problem that we've
but it could be abused. It can be abused,
and it has been abused
right,
when laws are being made and they're bypassing the legislation branch.
Yeah. So they're not really laws. There are and they're executive orders.
Yeah.
And so what you're pointing out is that
There's a fine line though.
Well, it's whether or not they're constitutional, whether or not we have rights. So you got to understand, you got to go back to the Bill of Rights. You have certain rights, 14th Amendment, whatever the amendments are, first, second, going on and on and on. And you cannot have a governor or the president of the United States step on those rights, but they could do it until it gets to the courts. You can't just stop it. They put it out there, and that's where it's going right now. It's going through the courts. But let me just make a point about where we are with the vaccine. And first of all, I think the key here is you should not mandate it. A business should not mandate it. The government should not mandate it, because why? First of all, it's still experimental. We don't know all about it. You got conflicting. From my perspective, I watch the CDC. I watch, I read Joe Rogan. I watch the Hoover Institute. I watch Gupta on TV, and I'm getting a mishmash of totally different things. They're telling us,
especially when they're talking about. I'll really short. Especially when they're talking about future lockdowns that were built upon by the fear of what Omicron might have been.
Right.
Right. But yet Omicron is mild, but those lockdowns are still possibly going to be.
Well, let's look at
it's just
right. How about another way? How about another way to look at this, Jeremy?
Yeah.
Let's just say this Omicron or all of it, Corona, is horrible. It's bad.
Right.
It's bad. It's well, why do we just rely on vaccines? Why are we pushing monoclonal antibodies?
Why are we relying on the same vaccine? Why is there no?
Well, they're coming up with they're coming out with a pill.
But it's taken them how long? Well,
that's another whole thing. But we have therapeutics. Why did we stop in this country and not jump on the bandwagon of therapeutics? One thing that Dr. McCulloch says is why we didn't go on therapeutics is because if there was any therapeutics that had a chance of really helping you, then people would not have gotten the vaccine.
Yeah.
Now, I understand there's politics in there. I understand the lesser two evils. Also, Pfizer made last year $33 billion. They don't have a sales force. They didn't have to do any. I don't know how much work they had to do. No marketing. My point is that I'm skeptical that there's also big pharma is making a lot of money here. But right now, I told you, we got to get rid of the politics. We got to start. Everybody should be eligible. Everybody should be eligible for monoclonal antibodies. It's supposed to be safe. If ivermectin works, then get it out there. I don't know if it works or not. I don't know if it's safe or not.
The crazy thing is
there's people saying it is. And why aren't we giving this stuff?
You just said that there's no marketing, and not directly from Pfizer, but from everyone else, as we've seen.
From some CNN and
or
Dr. Gupta.
Writing letters to Santa.
Right.
I mean, they're getting so much free marketing for this. It's crazy.
Well, why'd they go after Joe Rogan? He took ivermectin. Dr. Gupta was, his whatever it was, CNN.
Mm-hmm.
What was the I forget which one of the criticized him for that, and I don't. Who was the one anchor there?
I don't even watch CNN.
So and he, they criticized him. They said it was horse dewormer. Well, he got it from a doctor, and there's human being doses. There's ivermectin is taken by human beings. So they were disingenuous when they said that. So my thing is that we just list this. We just watched Dr. McCulloch, and I asked the questions, and my thing. What time are we, Jeremy? So we're gonna
we're good.
So my thing is this with Corona is number one is can you get it again? This is something I'm trying to look in the literature. I'm trying to find it out. And,
can you truthfully get it
again? Right.
Yeah.
Right. And, I wonder if this T cell sequencing is something that we should get. So in other words, I'm saying people out there, maybe you should look into it and say, hey, should I ask my doctor to get a script to go get T cells to test and see if that actually will tell me if I had corona or not. And then after that, do you need to get the vaccine? Do you need to keep on getting the vaccine? Because the way I'm looking at it right now, I got the booster, and then 6 months later, I'm getting another booster. I'm starting to worry now that this MRI stuff, this vaccine, is going to hurt me down the long term. Yeah. I mean, we're seeing they're coming. These guys are telling me there's myocarditis. There's people who,
and as we've always said about our show, that this is where your study starts. It's not where it ends. So the decisions you're going to make for yourself and for your family should start here, but it shouldn't end here.
No,
you make up your own mind on what's right for you and your family. Dr. Kachmar and we do this show to fight for your choice to make that.
And we do the research. I spent 3 hours listening to Joe Rogan. That was a 3 hour, almost a 3 hour podcast. I tell you what, do I believe everything that he said? This Dr. McCullough, but no, and yes, I want to know there's enough credible people that have arguments, that have disagreements with Sesame Street and Dr. Gupta. Okay. So I want to know where we're going with this and what's next, because we're going to have lockdowns again. We're going to isolate people, and we're mandating these things. And I think this mandate is bad because we don't know how risky everything is. And because of that,
the mandate was always bad.
Right.
Yes.
But I would push people to do more reading, more litter research,
because now you're seeing more, more shit is coming to light, right? Dr. Kachmar is finding out more stuff every week, and it's blowing his mind. Now you do your research and you'll see the same. We're starting to get new studies coming out. These amazing doctors that are coming out and talking about the truth of things. So that just opens your eyes to the mandates were always wrong.
Right. And I think that if you do get corona, if it's a breakthrough, what you want to, or if you never had the vaccine and you get corona, and you want to. And I don't know, like I said, if you're 60 years old, you're high risk, whatever, you should go right and get the monoclonal antibodies. The quicker, the better. And what it really is, this is how you ask for it. Now, listen to me. It's called sequential multi-drug monoclonal antibodies.
Okay.
So not all monoclonal antibodies are the same. So this is sequential, which means you're going to get it's about an hour-long transfusion. You can get a sub-Q, but it's an hour-long transfusion. So it's sequential. You get one antibody chemical, then you get another. So there's two. And then, it's multi-drug. So sequential, you get two drugs, one and another over an hour's time. And then, so it's sequential and multi-drug monoclonal antibodies. And I really, really strongly recommend it. That is and the reason I'm recommending it is because the CDC recommends it. Yeah. And everybody's talking about it. They say it works. I don't know anybody who is, saying it's not good to get. And they have criteria. The criteria seems to be fragmented all across the country and even in this area here, who gets it, who doesn't get it. And basically, I just talked to my ID doctors and my primary guy, and they're saying you got to go to the emergency room and you got to beg for it. And if they put your name in a computer or whatever, they say if you make the criteria. Right. So, but that stuff works, and the CDC says it works. The other thing is, maybe what's going to be a godsend, I don't know, when they come out with this pill in January, Pfizer, it's a protease inhibitor, just like ivermectin. It's a different chemical, but it does the same thing. So hopefully that will show some really.
I was really surprised just by how crazy things are, and whatever side of the right or left you stand on. I was very surprised when I saw Anthony Fauci admit that the Omicron is just it's mild and it's nothing too much to worry about. That surprised me.
Well, the thing with Fauci, sometimes he's, he's a politician, so he, and also all of us, we don't know, so we'll say things. I mean, in the beginning, I remember him say, this coronavirus can be no big deal. And then I remember him saying, don't get masks.
Is that they
all
could have used that to further their, I mean, like they want 100% of us vaccinated. We're at like 81, maybe a little over now, 81% vaccinated. But that would have been a scary thing to make everybody get that vaccination, but he didn't. He told the truth, and that was all right.
Well, here's the thing that we've always.
So when they do wrong, you're never going to hear me stop. But when they do right, I'm going to admit that.
Yeah. And I think what a lot of people get all anxious and everything, and thinking that everybody is a conspirator, everybody's evil. I think a lot of it is that in the beginning we had a lot of misinformation.
Yes,
and not given purposely, but who knows what came from China. The information and these things, and you put 10 doctors in a room, you're going to get 10 different opinions. And I think that what has happened with this, it would have been a different outcome, I think, if this coronavirus hit when it wasn't an election cycle for a president. So I think that it was unfortunate that it came down the pike when we were having an election. It got politicized. It still is politicized.
I remember when the election was going, Biden said the Trump vaccine is evil, and that very same vaccine he's pushing to get 100% of us to take now.
Right.
I mean, that's the kind of crazy.
Yeah.
I mean, that's a far extreme to the other side of the far extreme.
Yeah. They criticize it, and then the other thing is when you try to mandate all these people to get it, that's another thing that came into play. That was, and then you have the politics where you're a piece of garbage if you didn't get vaccine. You're un-American.
And they even said it's a pandemic of the vaccinated.
Right.
That's what they used as well.
So I had another friend.
And they called us domestic terrorists, and they called us a lot of things.
So now one of my friends says, well, you know what, Mike, even though there's say 10%, 30%, 40%, even 50%, or even 60% breakthrough infections.
Yeah.
It's a lot better than if none of them got it.
Right.
I said, I can understand that. But then again, if the vaccine is less effective, and they say, well, you got to get a booster now, okay, because it's weaning down. But let's just say apples and apples. If it's not as effective as 100%, we said 90, and now it's say 60. Then you start saying to yourself, okay, well, what's the risks now? Because if it's 100, it's 80%, and if say 95% going to save my life, but the risks are like 5%. You could die or have cardiomyopathy, some kind of problem, heart, heart inflammation. Is it worth it? If you say to yourself, I'm 20 years old, and if I get the damn thing, I'm not going to have a lot of problems, or I could get therapeutics. See, the paradigm is changing. That's my point. So I don't know how bad they are, but
let's use a different model here. You're going parachuting, okay? And then they tell you there's a 10% chance it won't open and you'll die. You'll die horribly. In fact, you'll die screaming until you hit the ground. Right. Do you want to go parachuting? No, I don't. No, not even at 10%. No.
Well, the thing is, a lot of people, I remember with AIDS, a lot of people, about 15% of the population never got AIDS. They're not going to get AIDS. They're immune to it. So,
and the AIDS fear was rampant.
Right. So I'm very sure. Right. And here's the thing. I had a patient. She, the husband, they were in their 40s. Husband got corona. The wife and the daughter never got it. They live with the guy. He's got brain fog now, so he has some issues. They didn't get vaccinated, and so you wonder, are they immune to it? Or whether or not they had it and they had mild symptoms, and now they have again immunity, or they never had it and they just won't get it because their cells won't accept it. I mean, AIDS is like that.
Do we have a Surgeon General anymore?
I don't know where he is.
Do we have one?
Because
back
we do.
in the AIDS, like the 80s, right? when AIDS was just all over,
Yeah,
and the
yeah,
fear
yeah.
of it was there.
Yeah.
I remember them like in health class wheeling in that big TV from the AV club, and we had to all listen to a video from the Surgeon General telling us that you will not get AIDS from sitting on a toilet seat.
Right,
You know?
right. We were all.
I mean, we lived in that kind of fear once upon a time, and now many years later, we're living in with a bunch of other different fears, and which ones are true, we're still trying to guess at.
Right. Well, my thing is that in the beginning with AIDS, there was a lot of misinformation.
Mm-hmm.
Same thing here, and
even masturbation with AIDS, they thought you could get it by just masturbating.
Yeah, it was all
The
kinds of
Surgeon
stupid
General
shit.
had to tell us that wasn't so.
There was. I think what's happening. Well, anyway, so I think people should go and look at this Joe Rogan piece with Dr. McAuliffe and make your own conclusions. I just, my whole thing about all of this is that it doesn't make sense to me that if you had the original virus, that you wouldn't have superior immunity. Now, will it wean and wane, and will the variants change? That I don't know. But these people are telling me no, it doesn't matter, and they're saying that the vaccine, is just the spike proteins.
If you had the alpha variant,
right,
the first one, you should be safe for all variants. Is that what we're saying?
Well, what he's saying is that because if you had natural immunity when you got the virus, you got T cells and antibodies against everything, like 20 something different parts of that virus.
Right.
Whereas which is a vaccine, you're only getting one or two like parts of the spike protein. So that's the argument. Again, is it true? And the articles are starting to come out, and you're getting more and more conflicting data.
Right.
And I just getting to me, even personally, I got 2 vaccines and the booster. I don't know if I want to get any more.
Right.
I'm like, okay, I did it.
Now, are you feeling regrets for getting the booster?
No,
any version of the? Or,
no. But I don't know.
Now in retrospect.
No, listen. Maybe it's like Russian roulette. Maybe. I mean, I pulled the trigger.
Right.
I lucked out. Or even it's like not even that bad. It's like I'm down in Atlantic City. I just hit. I hit on the roulette wheel. I just won $300. Yeah, I know if I keep on playing, I'm going to lose it all.
Yeah.
So I'm worried. Is that the scenario now? If I keep getting these friggin' boosters and boosters and boosters,
are you just waiting for that bullet to hit that chamber?
Well, I don't know.
Yeah.
So I mean, but so they want to. Here's the thing: instead of taking these guys off YouTube,
right.
Like Dr. McAuliffe and Rogan. Well, he's not even on here. How about we have an open debate? Like let's.
And there's that other fear that censorship. That they're really forcing a forced censorship,
right?
About
that scares me.
Yeah, that's the scariest.
Like
thing.
why they so
why
exactly why do you stop these people?
If it's all legit, right?
Right.
Then what are you afraid of?
We're that stupid. That's another thing. I mean, is the American public, are we that dumb? Do we have that much dumb people out there?
Yeah.
Then you know what? Then why don't you just mandate it for the dumb people?
Right.
And let the smart people make our own decisions. How about why don't we have a test? Like, say, you know what, Jeremy, fill out this form. Jeremy,
you're talking about a country that might be free. Why by saying that?
Well, listen, if they think we're, then just give it to the stupid people then.
Right.
Because that's what, because they can't make their own decision.
Wow.
I don't need the government or anybody.
Citizens of America making their own choices. That's some radical shit there, Mike.
I just think, yeah, I know. I just like to see them. I want, more and more discussion out on the public square. Yeah. I want to hear these people, and it's nothing new. I mean, but when they start to say, oh no, and again, going to after the children, we better make friggin' damn sure,
right?
Way damn sure that this vaccine is super, super safe. And what level? So here's the thing: if you have a drug out there, and say it's I invent a drug. It's it's called drug B. Drug B, and it cures rashes. And if it kills 5 people, right? At say 200 million people get it, and out of that 5 people die.
Okay,
that thing will be pulled. It used to be pulled. Or if it kills 10 people, if it kills anybody. So then you start saying, you know, but
because we put a
well,
heftier value.
I
on
should
life
say
back
what I
then.
shouldn't say it definitely
Yeah.
happens. I think I'm saying is what should happen. So in other words, people get the flu. One of my friends' father got the flu shot many years ago,
Right.
and he never walked again. He's crippled. He's paraplegic.
Yeah.
It's rare,
Yeah.
but it happens. People get what's thing called Gray-Barn syndrome. So I guess what I'm saying is, you know, where is the risk? There's a lot of people who believe that all these vaccines you get, the normal ones that we get, polio, MMR, and all that, cause autism. Now, they've done tons of studies for years and years and years. Doesn't look like that's the case. Okay, so it's been pretty heavy duty. Can you put the you know, our webpage up? So what I'm getting at is that we you know, what my point of train of thought was with children and you know, how dangerous this is, and you know, do we want to continue? I lost my train of thought now. Do we want to continue?
No, but you're right. When you add the children factor into everything that you just said about the percentages of how many people can die from taking.
I know it. Yeah, my point of thought. Right. So yeah. So basically, what I was saying is because I was looking at the monitor. I got distracted. The amount of people who have, you know, with normally, you know, drug that I invented. How many deaths? How many sequelae? How many adverse effects are we willing to accept? With regard to then helping everybody else out, you know, I think we have to go back.
How many deaths are enough to keep it
well,
going?
How you know, we had you know, the mask, the social isolation. We talked about how the social isolation is becoming worse than you know, people dying. And then the other thing is, I'll tell you one other thing because I'm getting tired. And before Corona hit, right?
Yeah.
We had some bad flu seasons. And if you look at the CDC, which is you could go in there and archive it. They'll say, you know, 60 to 40 to 60,000 people a year were dying from the flu.
Right.
Maybe some years a little bit more, some years less. So let's just say 50,000 a year. Okay. Die from the flu. And we didn't mandate vaccines. Some of the places tried to, like the hospitals with nurses, but you would have, you know how many people were hospitalized according to the CDC a year? Like 1.7, 1.5 million people are hospitalized annually for the flu.
Right.
That's huge.
Yeah.
I remember times where the hospitals were, there was no ICU beds. They were diverting. The hospital was so packed with patients who had the flu. So when Corona gets to that point, which you know, I don't know where we're at right now, but let's just say Corona gets to the point where, say, it's like it kills 100,000 people a year. This is a theoretical question I'm asking you. Corona kills 100,000 people a year. Okay. We got to hospitalize maybe 2 million people a year with Corona. Maybe a little bit, you know, so it's a little bit more than the flu. Remember the flu, say 50,000, double it to 100,000.
Yeah.
And maybe that's the new normal. And then with the hospitalization, instead of 0.17, let's just say 3 million. Is that at that point? What do we do? Do we still lock down?
So Are you asking? Why? How come the flu doesn't have the same stigma attached to it?
Yeah, well, that's one.
Yeah.
But beyond that, if we get to that point, when do we stop the pandemic? When do we say, hey, let's just go back to normal? Let's stop having this.
Yeah.
You know, yeah. Are we going to
because flus became told to the you know, the common man out there, they became just outbreaks, outbreaks that happened. When do we get there with COVID? Oh, there's a small outbreak, but everything's fine. It's nothing to be worried about or panic about or anything.
And like when you say, you know, there's two sides. Like Fauci, sometimes he's good, sometimes he's bad. Yeah. But then, like, look at now. You know, you have CNN. Remember when the president, when they were running for the election, CNN would have a thing. How many people died every day?
Yeah.
I don't know how they got those statistics anyway, but you know, but they had them.
How true?
Now, I don't watch CNN, but I don't think they have that anymore. Right. Are we like ticking down now? How many people died? Supposedly more people died now with Corona than you know, during Biden's administration.
Is part of that fake news anyway.
But what I'm saying is that when do we, you know, we focus on this stuff? When do we get the politics out of it? Number one, and just look at pure science and say, hey, listen, you know what? We trust the American people. this is what it is. Here's the science. You decide if you want to get a vaccine. You decide if you want monoclonal antibodies, and we if you want to pay for it, the insurance pays for it. But this is what we need to do. And we're still not doing that. We're still talking about closures. We're talking about, I still have people who can't get monoclonal antibodies. It drives me crazy. Why do we tell people? I just had 3 patients. They basically were told, go home and drink water. I've had doctors tell them that. And I'm like, and I asked one doctor, I'm like, well, what about monoclonal? You know what he said to me? He goes, well, you got to go to the emergency room and they'll fill out a form and they might give it to you or not.
Monoclonal antibodies, they're safe, right?
According to CDC,
how safe are they?
They're approved for pregnant women. That's from the CDC.
Why isn't something like that introduced into our drinking water then?
Well, you got to give it IV. It's not that easy. First,
but find an isotonic way of passing it through.
no,
right?
No,
they did it for fluoride, and that does nothing.
Well,
for
you're going to get listen, I don't know about ivermectin, but they're coming out with a pill.
Yeah.
Pfizer has the pill. Remember we talked about it? Mm-hmm. And maybe that's going to be a paradigm change. I don't know. I don't know, because you're going to get sick, but right now, I don't see any treatment. Nobody's given a Z-Pack. In other words, when you get corona, you go to an urgent care center or you go to your primary doctor. As far as I see, now some doctors are given ivermectin. I don't think it's FDA approved, or hydrochloroquine or Z-Pack. There's no treatment other than you go home and wait it out until, if you freaking get so sick, you go to, what do you call it, the emergency room. Why aren't we doing the opposite? Why aren't we saying, here's some pills you could take, here's the stuff, and try to get the monoclonal antibodies in quickly before you deteriorate?
Yeah.
If it's that safe and it's that available, and now I told you the Biden administration took control over the monoclonal antibodies, and I don't know if they're rationing it, but these are things that drive me crazy. I think the state of Texas opened up their own lab and making this stuff themselves. And there's talk about giving it prophylactically, Jeremy. So, okay, everything.
Yeah.
So
you put a condom on and then you got it. Yeah.
No, listen. Anyway,
Is there a different usage for that word that I'm missing?
What?
You say prophylactic.
Prophylactic, yeah. Prophylactic is you could use that. You're thinking the word, the noun as opposed to the adjective. In other words, there's a thing, a prophylactic. Okay. You could call a rubber. You could use that and call it a prophylactic, but that's the purpose of it. It's not, the word prophylactic means to prevent something.
I got you.
Okay, it's a condom. I think they call it a condom.
That's nice to know. I like that.
Right. But you're getting, so it's how you use the word. But prophylactic, that's why you made that joke last time. I'm like, what is he talking about?
Yeah.
When we say prophylactic, I'll give you antibiotics prophylactically when I'm giving surgery. That doesn't mean I put it in.
I love etymology, so the
like,
words and the origin of words. I love it.
It's funny. I talk to people, and I use words that I think are not that difficult to understand, and people have no idea what I'm talking about, and they ask me, which is good. But in this case,
I had a conversation.
So now you understand monoclonal antibodies has been discussed or has been used. I think DeSantis down in Florida as prophylactic, as a prophylactic measure against corona. So in other words, you never had the vaccine, you don't have corona now,
right,
but we give you the monoclonal antibodies, and there's some thought that you'll get 6 to 8 months of immunity. So it's an alternative. I'm not suggesting that. I'm not saying that's the proof or the accurate, but this is what I hear. So let's just say, but they don't want to push it because they think that the vaccine's easier and cheaper and maybe better. But how safe is the monoclonal antibodies? According to the FDA and the CDC, children could get it. And I think it's an approved. I don't think it's an experimental drug. That's a good question because it's been around. There's monoclonal antibodies used before for other things. Basically, what they do is they take the antibody, they sequence it from a corona patient, and they make this. It looks like a Y. It looks like a Y. The letter Y, and then they inject it into you. And again, you want sequential, which means multiple. One antibody, one monoclonal drug, and then another sequential multi-drug monoclonal antibodies. Because there are other stuff they could give you. So that's where we're at right now. And again, we should be pushing that. That was the whole idea initially. Get the vaccine out there. It's temporary. We don't want to give it forever. And it's not really a vaccine. It's new technology. It's not, understand this, polio vaccine, MMR, all of those vaccines are a virus. They actually take the virus and either kill it or weaken it, okay, or take its genetic guts and put it in another virus. But you're getting a virus. You understand? You're getting a virus.
Yeah.
Okay. This is not a virus. This is a messenger RNA, which means it's the genetic. It's just it's like a bunch of letters, dashes and dots. Basically, it's telling the cell to make the spike protein, whereas the vaccine, is actually the real organism. Yeah. So it's different. You understand? So this goes into the cells.
Yeah.
The cell takes it over, and the cell makes these spike proteins, which gets thrown out in the body, and then the immune system looks at them. Yeah. The other way is the virus gets in there, and the body recognizes it and starts a different process. But you understand it's different.
No, you make it sound perfectly simple. And that's how I think it should have been from the start before they took away.
That's because I'm simple.
No, you're not. No, you're not. It's very smart. Before they took away doctors' choices on dealing with the thing. Because you bring up the flu a lot of times, right?
Right.
Well, if people looked at the flu and looked at the numbers and stuff, but again, the flu doesn't have the same stigma. So when you're prescribing, say, to help somebody with the flu, you have some choices that aren't mandated. All right. You have some freedoms as a doctor, as a physician, to treat your patient who's suffering from something like this. But with the way they have done COVID and all of that, they took away all of your choices, all of your professional choices from you and your patients. And now you have to follow a mandate of your own.
Right.
So that's right. Why what you just said is how simple it should have been all along from the start.
Right. Because it got jammed up with the election.
Yeah.
Hydrochloroquine, why can't I give somebody, not me, I'm not a primary doctor, but why can't a primary doctor give you a Z-Pack and the hydrochloroquine? Now I know, it can mess around with your T cell if you have a T cell elevation.
Yes.
All right, so go get an EKG. We've been giving it to patients. I've been given hydrochloroquine for it's Plaquenil for arthritis. I don't give it a lot, but I'll start them on and they go to a rheumatologist. The other thing, ivermectin. Again, it got the pharmacists. The states would not allow the doctors to give it. And then doctors who talked about it, they took them off the air. They went after their license. That's crazy. They shouldn't be doing that.
And see, I believe that because it was taken away, all of this was taken away from the physicians, and they became mandates and stuff. If it had not been done that way, there might have been a hell of a lot fewer deaths than there were.
Well, that's what Dr. McCullough is saying.
Am I right?
Right. Well, Dr. McCullough is making that allegation. This on Joe Rogan last week. Yeah. Go, guys, listen to him. I'm not saying it. He's saying it. And this guy is an epidemiologist. He's written more papers than anybody on corona. I mean, he's all over the place. I mean, he's not a wacko. My point is when I listen to people who, Dr. Fauci, and Dr. Gupta, God bless their souls. But to me, they're paid actors. Yes. They're politicians.
Yes.
Okay. When I get this, and I don't know when the last time, I don't think they even see patients. And this Dr. Oz is another one. Oh. Just like that, he's
Oprah's lapdog, right?
I don't know what, but when I see a guy like this Dr. McCullough, again, he seems to be credible to me.
Yeah.
And I think we should be looking at some of the things he's saying and say, well, wait a minute now. Are we sure we're on the right course? Did we make a mistake? Did we do something wrong here? And I think I think it is so bad when you can't go into a hospital and hold your mother or father's hands while they're dying.
I know.
They died by something. My friend's mother just died yesterday.
There's no deeper sin.
He's on the phone talking to her. He's not allowed to go in. She's got corona. Now, he may have made the decision, but if you had corona, right? And it proves out. Wait, if you had corona, it proves out that you're never going to get it again. Then all those people who couldn't go see their loved ones was for naught. The other side of the coin is let them sign a piece of paper. You could put a hazmat uniform on, thing on them. Yeah. How much does it cost to, put a friggin' regulator on them? Let them go in and see their mother and father, or brother and sister, or child before they die.
The people that birthed you, that cared for you through every sickness, sickness you ever had, and you cannot be with them to their last days. That is horrible.
Tell me how it's bad. You're going to spread it and everything. Well, I tell you what, I'm going to go see my mother before she dies. I'll wear a hazmat outfit. I'll take the goddamn vaccine.
How are the doctors isolate and nurses in the hospital preventing from spreading it when they're treating people?
Exactly.
So you dress them up the same way.
Exactly.
So I can spend time with
exactly.
my granny.
So let's go back to the two nurses in August who I talked to.
Yeah.
They're at one of the hospitals. Both of them are in their 20s. Both of them are pregnant in August. Both of them worked on the corona floor, seen hundreds and hundreds and hundreds of patients, held hands on countless people who died. Right. The one girl got corona. All right. The other girl, she doesn't know. She might have had it, but she didn't. Her antibodies weren't there. And now I'm thinking maybe she got it. Right. They both got pregnant. They're like, listen, we don't want to get the vaccine until after our pregnancy. And the hospital said, you get it by January, you're out. Both of them they quit. They left. They said, see you later. And they said, we'll get it after our babies are born. They didn't want to take the chance. Now,
and that's what I was talking about earlier about mandates becoming law, forcing people to lose their livelihoods.
Now, I saw OBGYN doctors, reiterate what the CDC said. It says it's safe for women who are pregnant. So, okay. Again, I don't know, but I think that it would have been a lot nicer to say to those girls, okay, you want to sign a waiver, if you get sick or your baby gets sick, it's not our fault. You could wear uniforms. If they wanted to work, they wanted to work. They were working. So this whole thing is, maybe I'm an old fashioned, maybe I'm looking at it wrong, but I hope somebody listens to us and say, listen, everybody's got to start saying enough is enough. Show us the evidence. Show us, see, here's the thing. Right now, I read the article in the CDC and it's telling me this thing is approved, FDA approved 100%. But then I'm listening to Dr. McCullough. He's saying, no. And Peter Navarro, this is not approved. It's still under the Emergency Use Act. Okay. So who's right and wrong? What is it, Jeremy?
Yeah.
And then how dangerous is this myocarditis? How much is there really of this? And then how many, and I read the CDC, they have the one thing where if you drop dead within a week of getting the vaccine, they investigate it. Now, I don't know. It's like, I don't know how many thousands of people, but they're saying they would have died anyway. So I accepted that. CDC is telling me that, right? Okay. In other words, if you take 1 million people and in the next week, out of that 1 million people, say 5,000 are going to die.
Right.
But if you give 1 million of those people the vaccine and the 5,000 would have died anyway, you could contribute it to the vaccine. So I said, okay, that makes sense to me. That it wasn't the vaccine. They would have died anyway. Right. Now I got these people who are friggin' 1 million times smarter than I am, way, way more studied, more credentials, written papers saying, hey, Kachmar, I'm telling you right now, that ain't the case. We believe more people died from this than just a couple, 5.
Right.
So I'm saying to myself, whoa, wait a minute. I took the vaccine, but now I'm starting to say to myself, wait, we need to have more of a discussion. I don't want Dr. Gupta in there telling, having on Sesame Street, pimping these kids out to get the vaccine. How about we get a little bit more information? We need to have more, open up the dialogue. Stop. What's the word I want to use? Stopping people and taking them off, deplatforming them. Not letting them speak.
Subjugating them.
Well, they're
subjugation is the perfect word. Well, and that was going to be my next question to you. Have you ever seen a virus, taken care of through subjugation?
What do you mean? I don't get your point.
The mandates and all of that. We're a people who don't have any kind of freedoms to deal with the virus that's happening. When was the last time that ever happened? I'd like to know, because we had AIDS. AIDS was a huge fear. It was a very real fear for the people in the countries that were living with that.
Yeah.
But subjugation wasn't used to get it under control.
Well,
but with COVID, it was
Right.
the very first step they took.
well, listen, I'll give you this one. We, friend of mine, wanted to take his daughter up to New York City to go shopping. They, for Christmas shopping, they were going to take them somewhere, and the store that they were going to go to, they sent them. They have a thing on their email on their web page.
Yeah.
So listen to this. This is important. If you are between 5 and I think 16 years old,
Okay.
you need a governmental issued. This is New York City now. A governmental issued ID that you had at least one vaccine. And I think 16 and over, you need a governmental. This is what it says: governmental. I don't know, issued ID that you've been vaccinated, or you can't go to the store and buy anything.
Right.
Now, I had a friend. They were just up in New York. They were telling me he's a police officer. He was doing work up there. He does security stuff. He's a retired state trooper. He does, they move like very, paintings with Celebes, whatever.
Okay.
He's up there and
Armored car driving.
yeah, but it's more sophisticated. He's private security.
I got you.
They were up there not too long ago, and they drive up. They want to go get a cup of coffee and a sandwich. They go over to the store. The girl, who can't even hardly speak English, which begs wonder if she's even legal, is saying, "Do you have your passport, your card?"
She might be one of the 2 million.
She's goes, "Do you have one of the cards?" And they're like, "No." She goes, "Sorry, senor, can't give you any. You can't have a cup of coffee and a ham sandwich." Are you? Because he doesn't have his.
Is that a real thing?
Yeah, he just told me last night.
So if you don't have proof of vaccination, you can't even buy a cup of coffee?
No. This wouldn't let it. Now, he said they.
See, and you looked at me sideways when I said subjugation.
No. So listen to this. They went, if it was another day, they went somewhere else, and they were a different part of the Manhattan or wherever they were, a different part of New York.
Right.
And it was it was like this Mexican place, music's playing and tacos are going. And they didn't give two shits. They gave them beer. They did. So, and I don't know what the moral to that story is, but my point is that this is so. But here's the kid. Here's the kid. All over the world. So, but here's you cannot
plastic straws or paper straws.
You cannot take. Here's the thing though. You want to go to American Doll.
Oh yeah.
In New York City right now. You have to have a ID that you got vaccinated. Now, I don't know.
Is Ava into that stuff?
Yeah, that's what I was telling them. We found out you cannot go. American girl said you cannot go up there. You have to have a governmental issued ID that you were vaccinated. So I don't even know what that means. So I mean, do I have to take the card?
Child?
I just told you. Listen, you're not. See,
I'm not listening. No,
okay,
no,
listen.
Because it's blowing my mind.
No, listen. This is what they said on their webpage. Everybody could go and look at it right now.
Okay.
American Doll, the store, says if you're between 5 years old and 16, they're going to cut you a break. All you got to show is a governmental issued document card that you were vaccinated at least once. If you're 16 and over, you need to have a governmental ID that you were vaccinated twice. Fully vaccinated. And I don't know, maybe they're going to even talk about the booster. So now, probably after January, be the booster. So you cannot go to the store. This is real time. This is real. So now listen to this, Jeremy. So think about the ramifications. So then last night I went out to dinner with my bunch of my buddies. Some of these guys are retired state troopers. And one told me, I'm not making this up. I mean, he's not bullshitting. He was up there, I don't know, a week ago, 2 weeks ago, whatever. And he could not get a cup of coffee. He didn't have his card with him. Or even, I don't know if he even has a card. And in fact, he doesn't have a card because he didn't get vaccinated. He got corona. He got the monoclonal antibodies. So he ain't never, he doesn't have a card. Yeah. So you can't get, you have to go search around. That's crazy. Now, but here's the thing. What are they saying, a governmental card? That means I have my vaccination card. It wasn't given to me by the government. It was, the hospital where I got it. Yeah. So I got to take that, go online, get it validated, or, go to probably have to go to a governmental thing, a governmental portal. I don't even know this, where it probably has my name, and then have them print out something. And if the hospital or it wasn't put on what's the word I want to use? It's you know, the database. I'm screwed. But you can't so you can't, the kid can't go up there. The kid, this 8-year-old kid can't go up there and get you know, go to the store. We were going to go up there in New York. So now that means, you know, we would take the ferry boat. They're going to lose money. You know, we would have got an Uber maybe, stop at a restaurant. So multiply that. And because I can tell you right now, the mother is not going to get the kid vaccinated. She's 8 years old. The mother's like, no way. So where are you going? Now, these guys who are working up there, you know, they got to bring their box lunch, but how many restaurants are going to go under? How many? I mean,
how many more? You mean how many more are going to go under?
But is it necessary? I mean, you can't. I mean, so before McDonald's. I mean, before we had. Here's the thing. Before we had,
I got my vaccines from ShopRite.
Right,
What
but
the hell? Well, and they gave me a card. So do I have to show the receipt as well?
But here's the thing: what's the purpose? If back when we isolate everybody, you wear a mask. So if you're going to go into a shop and buy a sandwich, a ham sandwich, and a cup of coffee, say wear a mask.
Right.
Why do you have to show a friggin' card?
Wait a minute. You're telling me you got your vaccine in the middle of a can sale? No.
But gets me, you know, and then a lot of people probably just getting them, you know, buy fake ones. But my point is, what's the reason? What's the reason you have to have a friggin' card?
It's nuts,
you know,
man.
I mean, and then, you know, what is it? Hot dog guy out in selling pretzels in New York City. You go up, you can't get a pretzel unless you have a card.
Because I don't have this card, I cannot enjoy the freedoms that this country says I have. Because
you can't buy a cup of coffee and a ham sandwich in New York City.
Really?
Theoretically, well, by the law, you can't. They probably,
is like, listen, and I don't want to.
If they sell it to you, they're probably breaking the law.
I don't want to offend anybody, but this is like showing me shadows of, you know, whites only, or, you know, stuff like that. Like, you know, when you subjugate people and you put people in that position, how do you think they're going to feel?
Yeah, well,
how do you think it makes them feel when I can't take my little daughter to go get an American Doll? It's all these girls. I mean, they lose their minds over these things. Okay. And when you take them to the American Doll store, it's a big event. Okay. It's a big deal. All right. They go and look, they buy the dolls, they look for clothes. They want little, you know, all the little accoutrement for it and accessories and such. But now I'm sorry, honey. I'm sorry. I'm sorry.
So
because me and your mother are thinking about your health and your future, we've decided that you're not going to get vaccinated right now. But there's a little boy on the TV who's getting it from Santa Claus. I'm sorry, honey. I'm sorry.
Well, we have Dr. Gupta on Sesame Street, you know, saying it's okay.
Do you see the picture I'm painting?
Well, here's the thing.
It's absolutely absurd.
But play the devil advocate here. You know, the CDC is saying it's safe for children. Okay, let's just say no problems. And then say it's like the guy would say, or the people would say, why don't you just go get the vaccine? It's safe, and then you could go up to the New York City and enjoy yourself.
Right.
The problem is Dr. McCullough and other people are saying it's not that safe.
Right.
Okay. And you know, again, we're having, you know, you could say, oh well, this is you know, they're bad doctors, or they don't know what they're telling, conspiracy. But when more and more people are coming out with these you know, cautionary tales,
right?
I would say, you know, push the vaccine, advertise it if you want, but don't mandate it, and don't stop us from buying stuff and doing things like that.
Don't stop doctors from being doctors either. That's a big deal.
Yeah.
Like doctors, they went to medical school for a reason. We trust them with every other thing. Why would you take away their professional views on this?
Okay, and let me ask you this. Now, what we're seeing is there's breakthrough with these infections.
Right.
So, I don't know, 30%, 40%. So, if you mandate a card and they got corona, you don't test them right off the bat, you could still be getting it. So how much is that? You know, oh, it's going to minimize it a little bit, or how much? You know, then wear a mask. It's probably just as good.
Yeah.
So my point is that no, this is real time.
Yeah.
And I like I said, I just wanted to throw that out there. So you know,
that is the American Doll thing is so absurd. It's anti-American, is what it is. That's like screaming anti-American.
Well, I'd like to see, you know, how much this is going to affect this country. Because here's the thing. Next, it's going to be, well, you need a booster.
Yeah.
Now, my friend's daughter, I just told you, this is now I was just talking to him. This is real time. This is stuff that I know personally. This ain't bullshit. The daughter is 20 years old. She had corona, lost her taste, all of that. Then after that, even though despite that, the college that she goes to made her get the 2 vaccines, or she could not go to school. Now, maybe she could have went and she got tested every day, and but now she's home on Christmas break.
Yeah.
Okay, she is not going to be allowed to go back to school in January without a booster. Had corona, probably could test her T cells, and I don't even know if it matters if they care about that. 2 corona shots now, and she's 20 years old, and they're requiring another shot, a booster.
Completely removing her freedom of an education,
or no school.
Yeah, unbelievable.
And so now, and the mother, here's the conflict. Now, here's the thing. The mother is saying she's got to get it. She's not going to go. The father's like, I don't want her to get it.
Right.
And in fact, the father, I know him too. He's got corona now. He had 2 shots, and he's got corona. He's not that bad. I mean, he's home, but I haven't talked to him today. So, and then, so it goes around.
You know what I'd love to say, and it'll never happen. I know it'll never, ever happen. If you've gotten your 2 shots and your booster, okay,
right,
and you get coronavirus, I think every American who fits into that criteria should get a letter of apology from President Biden.
Good luck on that.
Yeah, I know. That's what I'm saying. But shouldn't they? Like this, we're being told that this is it. Like it or lump it, take it down to the corner and dump it.
I listen. We're going to end this show.
Yeah, we're over our 2-hour mark.
I want to give you this insight. This is what I say. Listen, I don't think everybody's trying to struggle with this, and I'm very sure the politicians too. We talked about Cuomo and we talked about Murphy, and and they did what they did, and I think that they what they did based on what they had then was the right move. I think that there's a good saying. And I always go, power corrupts, absolute power corrupts absolutely.
Absolutely, yeah.
And I think that there's a lot too much people who are making decisions who have too much power. Number one. Number two is we should be very cautious about mandating anything, because when you mandate things, you take choice away from people, and you make the impression that, I get the impression is that they don't trust the American people to make the right decision.
Yes.
And if you look at the statistics too, a lot of the Hispanic and Black don't get the vaccine. And I think a lot of that is, they're researching it, and they may have higher risks because they have higher risk with the corona itself. But the point being is that you need to let the American public make their decisions. We need to really have an open discussion. Don't stop people, Facebook and YouTube and Twitter and all that. Don't stop people's opinions. If it's an opinion, then let it be debated.
Stop the subjugation. That's what it is.
Well, when you say that don't. I would stop. Here's my point: is I would stop
that's calling a kettle black. Though.
I would go. I would go.
What it is.
Well, I think what it is that it's our overuse of power.
Yeah.
But let people make the decision. And let's get a debate. Let's, like Dr. McCullough. I know they've been in front of Congress and there's arguments, and I've seen them. I watch other senators. They go after him, and they're basically telling him, you're crazy. You're putting this stuff out. And I'm like sitting there going, okay, well, show me then what your stuff is, where your statistics are. And, I at the very least, it could be a drawer.
All right.
I mean, I don't see overwhelming evidence, on both sides. I mean, it's close. So my point is, if it's close, and you don't know 100% sure, and the other guy don't know 100% sure, well, then why don't you let us make the decision? Let the mother, father make the decision. Yeah. Let us decide if we want to get a vaccine or not, and don't put a gun to our head and say, if you don't get this, you're going to be castigated. You're going to lose your job. You can't go and do things. And that's not right. Like
you
the 2 nurses
partake in other things Americans are doing. Sorry, you're going to have to stay home and like it.
And then make this, and same thing with the hospital and all that. So anyway, I think people should go to the Joe Rogan podcast last week, Dr. McCullough. Look at that. I think it's a great thing. Read, your book where you talked about Joe Kennedy.
The real Dr. Fauci.
Right. I think that's a great book. I think Peter Navarro's book, and understand and tell us, tell us if we're wrong. So, I want to get these doctors on here. I got one guy, who he may, they may be saying, listen, you guys are all crazy and what you're talking about is bullshit. So come on our show. We're giving you an invitation. Call in and tell us where we're wrong. Tell us where the evidence is based, where, we should be everybody should get a vaccine. Every kid should get a vaccine and keep on going with boosters. And there's absolutely no risk. And then, if the risk is a little bit, worse than if you get the vaccine, a virus, show me that, and again, I don't, and
a little bit more transparency is what we're asking for.
Right. That's all we're asking for. That's it. So anyway, Jeremy, we talked about a lot of things today, the Nutrimetrics. If people want to get a hold of me, I'm Dr. Michael Kachmar. So I'm a board certified foot and ankle surgeon.
That's right.
And I have offices in Bayville and Barnegat. And Jeremy, can you put up? So if you want to get a hold of us, our webpage is Jersey Shore Foot and Leg Center. Jersey Shore Foot and Leg Center. .com, excuse me. This is an informational and opinion show. So anything we say here is opinion. So don't, like we said, be nice to everybody.
Consider it a buffet.
Right.
You take what you want and you leave the rest.
Right. And no violence, nothing like that, but we're trying to get you to get your
brain
taste
thinking about things.
And go check things out. Don't take everything for granted.
Questions.
Right. If you want to email us, it's called drkachmar@icloud.com.
Yeah.
That's drkachmar, Kachmar at icloud.com. And we're going to be here. Well, we got the holidays coming up. We'll probably do a show, maybe a medical show Wednesday. We do have a lifeguard show, which is every Tuesday. You guys can watch. It'll go again. Here it is. And you can watch us and listen to us on YouTube and Facebook or on Twitch and Twitter and Apple Podcast and Spotify. So, Jeremy, you want to say goodbye?
Yeah, we're in the middle of this Christmas season. Come on, guys. Let's be kind to each other.
Right.
It's the one thing I hope for all of you every single week.
Right. And, we are
podcasts, so find us on iTunes, Yahoo, wherever fine podcasts are found. You can type in Scrubbing Up and you will find us. Okay. And like I said, in the meantime, be kind. It's that time of season now.
All right. Well, Jeremy, it's up to you. You could sign us out. And everyone, take care. We're going to say goodbye right now. And have a nice night. And we'll see you soon. Stay out of trouble.